planning a very exciting and top quality meeting in internal medicine. We want to share ideas with colleagues, we want to have updates on important topics of internal medicine, we want to reflect about the future of internal medicine in Switzerland and Europe, and of course there's going to be an important scientific program to which we hope a lot of young clinician scientists will present their work and share their ideas. Actually, together is what we're already doing every day as internists. In modern medicine, we don't work alone, obviously. So together has a series of meanings. First, of course, we're going to be European and Swiss internists together, and that's going to be a very special moment, and we're looking forward to that. Then in our everyday work, we work together as general internists, but also with specialists, cardiologists, nephrologists, etc. So that's a second layer of being together. Thirdly, of course, we don't work singly as physicians, even with various colleagues of various disciplines. We need other people, we need nurses, we need other health professionals, we need social workers, we need all the people who work in the community. So we need to be together around the patient. And there's going to be a very special session, which is going to be one of the highlights of the Congress, on a new topic that's emerging, because we're migrating from interdisciplinary care to really truly integrated care. And in integrated care, the patient is at the center, and all people work together at all times in his patient trajectory to assist him staying healthy or becoming more healthy as much as possible. We're going to have basically 3 types of activities and a lot of parallel sessions. One is going to be plenary lectures and then also workshops and learning centers. Regarding the plenary lectures, we're going to have some trend lectures. These are really sort of think pieces on what's happening now, what are we reflecting on in internal medicine today, in varied domains such as ethics, caring for the oldest old, clinical and diagnostic reasoning, patient empowerment, and so forth. And we're going to have some very prominent international and European speakers for those sessions, among which, for instance, since that's only one name, so I don't want to be unfair to the others, but we're going to be privileged to have Zeke Emanuel, who is one of the chief ethicists in North America right now, also a very distinguished hospitalist, Sanjay Saint, also William Gali from Calgary, who's a hospitalist invested in imagining the ward of the 21st century. So a lot of very brilliant and engaging people. Then we're going to have updates, obviously, on all the topics of internal medicine across specialties, from acute internal medicine to geriatrics, going across cardiology, nephrology, etc. And finally, we're going to have some symposia on various themes. And the idea there is really to improve our culture as internists on very varied topics. For instance, aging, from cell biology to medical and social consequences. Also cancer, what kind of modern targeted therapies do we have for cancer and autoimmune disease. Also genetics, what should the internist today know about that topic, and so on. So a lot of very exciting sessions that we're expecting in Geneva. And finally, more practical sessions directed on how do I manage this or that disease, COPD, atrial fibrillation, pulmonary embolism, and that is going to be very useful to internists and practitioners all over Switzerland and Europe. All the plenary sessions are going to be in English. This was object of some debate because we wanted everybody to be able to share this experience, but that's what being together is about, and English is the only language in which all European persons and all the Swiss citizens can understand each other and share knowledge and ideas. Practical oriented sessions, workshops and learning centers are going to be a little bit different. Some are going to be in English, obviously for our European guests, but some are going to be in French or German because it's important that people feel comfortable in those closer, smaller sessions with fewer people. ideally, an active participant will have had the opportunity to meet some colleagues, those he or she already knows, but also to make new friends, exchange ideas, refresh important knowledge in internal medicine, acquire new knowledge, and hopefully go home with new ideas on the way to practice internal medicine and a perspective on what's cooking in our profession. Well, first, there was the idea of the Swiss Society of Internal Medicine to do something with the European Federation, because we have had close ties since a long time, and we were very happy that our European colleagues chose Switzerland as a partner for this Congress. And then the choice of Geneva was sort of logical, because we wanted to have an international orientation, and Geneva is a very internationally oriented city. We wanted it to be accessible, and of course we wanted it to be a memorable experience for our guests, because Geneva is a wonderful city. Well, because I consider it my city now. I've been living in Geneva, and I really think it's a privilege for over 30 years now, and I enjoy it immensely. Geneva is multicultural. Geneva is a beautiful city with a history, a lot of architecture, with fantastic museums, and one that is very dear to my heart is the Red Cross Museum. It's not a traditional museum, but it's a museum that attests to the international dimension of Geneva and its openness to the world, including to people that are less fortunate than us. So add to that the lake, the mountains, a lively city with lots of cultural events and entertainment, and I think it's going to be a very nice place to be in May 2014. So I'd like to conclude by inviting you to Geneva, to what's going to be, I hope, a fantastic venue. We worked very hard to make it satisfying for everyone and welcoming for everyone, and I'd like to invite you on behalf of the Scientific Committee, on behalf of our IFIM members, and particularly Nika Capellini, who is the president of IFIM, Frank Bosch, IFIM Vice President Daniel Sereni. We're waiting for you in Geneva. We hope you'll be very many to come to visit us, and you're going to have a great time.
Уважаемые дамы и господа, мне выпала особая честь пригласить гостей из России принять участие в самом первом Европейском и Швейцарском конгрессе внутренней медицины в одном из самых интернациональных городов Европы, в Женеве. Вас ожидает богатая и увлекательная, а также многоязычная программа. Мы сделаем все от нас зависящее, чтобы эта программа была подготовлена достойно вашего приезда. Мы очень надеемся, что будем иметь возможность приветствовать много наших российских коллег, потому что ваш вклад на нас очень важен. Мы хотели бы выразить особое приглашение нашим российским гостям и будем очень рады увидеть вас в следующем году в Москве. Добро пожаловать в Женеве!